Hello everyone, I'm one of the speech therapists working for the Disability and Special Needs team at Community Family Services of Ontario. Welcome to our education series. Today we are going to talk about hearing loss and the importance of hearing screenings. Hearing screenings are an important part of medical checkups. Early hearing screening help identify potential issues related to speech and language learning. For older individuals, regular hearing screenings can help prevent significant decline in hearing abilities as they age. Here at CFSO, our goal is to reach out to the community and raise awareness about hearing health and the importance of hearing screenings. We provide odometric screenings, hearing screening services, basic hearing aid maintenance, and communication partner training workshops, as well as referral services. The anatomy of the ear are as followed: the outer ear, the middle ear, and the inner ear. The outer ear, the visible part of the ear, is called the earlobe or pinna, which helps transmit sound into the ear canal onto the eardrum, causing it to vibrate. The middle ear. The eardrum is attached to 3 tiny bones in the middle ear cavity. These bones pick up the vibration from the eardrums, amplify it, and transfer them into the fluid-filled cochlea of the inner ear. The inner ear. The inner ear is made out of a structure called the cochlea, which is lined with hair cells that translate those vibrations into electrical signals, which is then carried into the brain for interpretation. Hearing loss is categorized by types of hearing loss: sensorineural, conductive, and mixed hearing loss, and degree of hearing loss from normal to mild and all the way to profound hearing loss. Sensorineural hearing loss. Sound reaches the inner ear, but damage to inner ear prevents proper hearing. This type of hearing loss is usually permanent. Conductive hearing loss. Sound is unable to reach or is blocked before it reaches the inner ear. This type of hearing loss may be temporary or treatable with medical interventions. Mixed hearing loss, where both conditions contribute a little. Hearing loss is also categorized by degree of hearing loss. Mild hearing loss can be considered when there is difficulty hearing some sounds with high frequencies, like s or sh, while profound hearing loss can be considered when people have lots of difficulty hearing speech, but loud environmental noises like fire trucks or airplanes taking off may still be audible. Please note, people with severe to profound hearing loss are also more susceptible to balance problems and are greater fall risk candidates. One of the most common type of hearing loss is age-related hearing loss, or presbycusis. It is a type of sensorineural hearing loss where one loses the hair cells in the inner ear due to old age and largely based on hereditary factors. Another common cause of hearing loss is due to long and repeated exposure to loud sounds like construction noises, being near airports or concerts. Frequent ear infections, especially as a young child, could result in hearing loss, whereas many cancer chemo treatment drugs are ototoxic, meaning that they cause permanent damage to your hearing. There are multiple types of hearing aids that we may see. Hearing aids suited to your specific needs will be recommended to you by a professional audiologist. The area highlighted in yellow represents the frequency range where speech sounds normally occur. Hearing loss in this range may mean that some of these important speech sounds cannot be heard. This may lead to difficulty in identifying and understanding speech sounds, which would result in delay in speech and language development in young children, or challenges in accurately understanding conversation. Let us now highlight some of the signs and indicators that may suggest that your child has hearing loss. 1. Frequent ear infections may cause permanent damage to the eardrum or middle ear structures. 2. Children should begin to start babbling and say single words by 12 months and respond to their names. Research has shown that even a mild hearing loss delays important speech and language milestones. 3. Premature birth is also one important factor, as the structures in the ear are not fully developed until 32 to 35 weeks of pregnancy. It is highly recommended to seek medical attention from an audiologist to conduct a professional hearing screening and assessment if you notice one or more of the signs mentioned above. Many developmental disorders such as autism, learning disabilities, intellectual disabilities have symptoms similar to hearing loss. If you notice a delay in babbling or acquiring language for your young children, or if you find yourself needing others to repeat themselves frequently, one should consider seeking professional medical advice to rule out certain diagnoses. Reach out for help when needed, as early intervention is best practice to support your child through their development and growth, and to prevent significant functional decline in abilities as we age. Please pay attention to CFSO website or promotional materials for our conversation partner workshops. Support communication partners to effectively communicate with those with hearing loss. Learn about how to support people with hearing loss in maintaining their social and family relationships. Thank you so much for listening. I look forward to seeing you in the next educational series.